If you fear cholesterol more than death, then today your understanding of health will be completely transformed. What doctors have been telling you for the last 30 years about cholesterol has turned out to be the most destructive medical lie of our time. Millions of people take statins that destroy their liver and muscles, while the real killer goes unnoticed. You give up eggs, butter, and fatty meats, thinking you are saving your heart, but in reality, you are depriving your body of vital nutrients, without which the brain stops functioning properly and the immune system becomes defenseless. In my 40 years of medical practice, I have seen thousands of patients who religiously followed cardiologists' recommendations, lowering their cholesterol to extremely low levels, and yet they suffered heart attacks, strokes, and developed dementia faster than those who did not receive any treatment at all. I studied research from leading global institutions, analyzed data from countries with the highest life expectancy, and came to a shocking conclusion that completely contradicts the official medical doctrine. Cholesterol is not your enemy. Moreover, attempts to artificially lower its levels can lead to premature death. Today, you will learn 5 critical facts about cholesterol that pharmaceutical companies are hiding from the public. I will explain why low cholesterol is more dangerous than high cholesterol, what tests actually indicate the risk of heart disease, and what you need to do to protect your vessels without destructive medications. You will understand which foods truly cause atherosclerosis and which have been unfairly demonized by modern medicine. By the end of this video, you will know more about the prevention of cardiovascular diseases than most practicing doctors. Let's start with what you are told at the clinic. You take a blood test, and the result shows total cholesterol of 6 or 6.5 millimoles per liter. The doctor looks at this number, shakes their head, and immediately prescribes statins, explaining that your vessels are clogged with cholesterol plaques, and if treatment is not started immediately, you face a heart attack or stroke. You leave the office scared, start taking pills, and go on a strict diet, eliminating all animal fats. 3 months later, a follow-up test shows that cholesterol has dropped to 4 millimoles. The doctor is pleased, and you feel like a hero who has saved their own heart. But what is really happening in your body? Cholesterol is the primary building material for all cell membranes in your body. Every cell, from brain neurons to skin cells, needs cholesterol to maintain its structural integrity. When you artificially lower its level, cells begin to break down faster than they can recover. Your brain, which is made up of 25% cholesterol, starts to experience a deficiency of this critically important substance. This is why patients on statins often complain about memory problems, brain fog, and difficulties concentrating. Cholesterol is also the basis for the production of all sex hormones. From cholesterol, your body synthesizes testosterone, estrogen, and progesterone. When cholesterol levels drop too low, the hormonal system begins to malfunction. Men lose libido and muscle mass, while women face premature menopause and osteoporosis. Additionally, cholesterol is necessary for the production of vitamin D in response to sunlight. Low cholesterol means a deficiency of vitamin D, which leads to a weakened immune system, depression, and an increased risk of autoimmune diseases. Now pay attention to a critical fact that changes the entire picture. Your liver produces about 80% of all the cholesterol in your body. Only 20% comes from food. This means that even if you completely eliminate cholesterol from your diet, your liver will continue to synthesize it in large amounts. Why? Because cholesterol is vital for survival. The body never produces harmful substances on such a scale. If the liver is actively synthesizing cholesterol, it means it is receiving signals that the body needs this substance for repair and protection. This is where it gets interesting. Cholesterol rises not to damage your vessels, but to repair them. Imagine that the walls of your arteries are damaged by inflammation. These microscopic cracks and tears need to be urgently patched up, otherwise bleeding will start or a clot will form. The body sends cholesterol to areas of damage to patch up these cracks, just as builders use cement to repair a wall. Cholesterol acts as an emergency crew, saving your vessels from destruction. But modern medicine makes a fundamental mistake. Doctors see cholesterol in the area of an atherosclerotic plaque and conclude that cholesterol is the cause of the problem. It's like blaming firefighters for starting a fire simply because they are always seen at the scene of the blaze. Cholesterol does not create damage to blood vessels. It arrives where damage has already occurred to perform repair work. The real question is, what exactly is damaging the walls of your arteries, prompting the body to send cholesterol there for restoration? The primary cause of vessel damage is chronic inflammation caused by excess sugar and refined carbohydrates in the diet. When you eat white bread, pasta, pastries, or drink sugary beverages, your blood glucose level spikes sharply. A high concentration of sugar acts as an abrasive, scratching the inner surface of the arteries. These scratches activate an inflammatory process. The body sends cholesterol for repair, and doctors see elevated cholesterol and blame it for atherosclerosis. In reality, sugar is to blame, not cholesterol. The second reason is industrial vegetable oils, which are considered heart healthy. Sunflower oil, corn oil, and soybean oil contain a huge amount of omega-6 polyunsaturated fatty acids that easily oxidize when heated and even when stored in light. These oxidized fats integrate into the vessel walls and cause inflammation much more intensely than any animal fat. The paradox is that you were made to give up butter and lard, which are stable and safe, and switch to vegetable oils that actually damage your arteries. The third reason is magnesium deficiency, which occurs in 70% of the population over 55 years old. Magnesium is necessary for the relaxation of the smooth muscle of the vessels. When there is a lack of magnesium, the arteries are in a state of constant spasm, blood pressure rises, the walls of the vessels experience mechanical stress and begin to crack. The body sends cholesterol to strengthen these weakened areas. Instead of replenishing magnesium deficiency, doctors lower cholesterol with statins, depriving the vessels of their protective mechanism. The fourth reason is chronic stress and elevated cortisol levels. When you are constantly anxious, worried, and not getting enough sleep, the adrenal glands produce an excess amount of the stress hormone. Cortisol raises blood pressure, increases blood sugar levels, and causes systemic inflammation. All of this creates ideal conditions for vessel damage. Cholesterol comes to the rescue again, trying to patch up these damages, but it gets all the blame for what happens. The fifth reason that almost nobody talks about is a deficiency of vitamin K2. This vitamin is responsible for the proper distribution of calcium in the body, directing it to the bones and teeth, while preventing it from depositing in soft tissues and vessels. When there is a lack of vitamin K2, calcium begins to settle on the walls of the arteries, making them stiff and brittle. Cholesterol tries to coat these calcified areas, protecting the vessel from complete destruction. The modern diet, low in fermented products and animal fats, contains virtually no vitamin K2, creating an epidemic of vascular calcification. Now let's talk about which test is truly important for assessing the risk of cardiovascular diseases. Total cholesterol is an absolutely useless indicator. It says nothing about the actual condition of your blood vessels. There are two main types of cholesterol, LDL, which is called bad, and HDL, which is considered good. But even this classification is too simplified. LDL comes in different sizes. Large, light LDL particles are safe. They pass freely through the vessels without causing any problems. Only small, dense LDL particles are dangerous, as they can penetrate the artery wall and oxidize there, causing inflammation. Standard cholesterol tests do not differentiate between these subtypes. They only show the total amount of LDL without indicating the size of these particles. This is why it is possible for a person to have high LDL, but if it consists of safe large particles, the risk of atherosclerosis is low. Conversely, a patient may have normal or even low LDL, but if it consists of small, dense particles, the risk of a heart attack is very high. To get a real picture, it is necessary to conduct a detailed analysis of the lipid profile, which shows the ratio of various subtypes of lipoproteins. The second critically important indicator is the ratio of triglycerides to HDL. If you divide the level of triglycerides by the level of HDL and get a number less than 2, it indicates a low risk of cardiovascular diseases, regardless of your total cholesterol. If this ratio is greater than 4, the risk is high, even if total cholesterol is normal. This simple calculation provides much more information than all the discussions about lowering cholesterol to some mythical target values. The third indicator that needs to be checked is the level of homocysteine. Elevated homocysteine directly damages the walls of arteries, causing the very inflammation that the body tries to treat with cholesterol. Homocysteine increases with a deficiency of B vitamins, especially B6, B9, and B12. If your doctor has never checked your homocysteine, but prescribes statins based on total cholesterol, it means they are treating the symptom, not the cause. The fourth marker is high-sensitivity C-reactive protein. This test shows the level of systemic inflammation in the body. If C-reactive protein is elevated, it means inflammation is currently damaging your blood vessels. In this situation, you need to find the source of the inflammation, not lower cholesterol, which is a protective response to that inflammation. Now, the most important part of our conversation is what to do to truly protect your heart and blood vessels. The first and foremost step is to completely eliminate sugar and all foods containing refined carbohydrates from your diet. This means avoiding white bread, pasta, rice, potatoes, all pastries, sugary drinks, and juices. These products raise glucose and insulin levels, trigger inflammation, oxidize cholesterol, and turn it into dangerous small, dense particles. If you make just this one change and nothing else, your risk of cardiovascular disease will decrease by 40% within 3 months. Second, replace all vegetable oils with traditional animal fats and tropical oils. Cook with butter, ghee, lard, beef tallow, or coconut oil. These fats are stable when heated, they do not oxidize, do not cause inflammation, and actually protect your vessels. Add fatty sea fish to your diet 3 times a week to get omega-3 fatty acids, which have powerful anti-inflammatory effects. Eat eggs every day. Do not fear the yolks, as they contain phospholipids, choline, and fat-soluble vitamins necessary for brain and liver health. Third, replenish magnesium deficiency. Take 300 to 400 milligrams of elemental magnesium daily in the form of citrate, glycinate, or taurate. These forms are well absorbed and do not cause gastrointestinal upset. Magnesium will relax your blood vessels, normalize blood pressure, improve sleep, and reduce stress levels. You will notice results within a week of taking it. At the same time, increase your intake of magnesium-rich foods, pumpkin seeds, almonds, dark chocolate with at least 80% cocoa, spinach, and avocados. Fourth, start taking vitamin K2 in the form of MK7 at a dose of 100 to 200 micrograms per day. This vitamin activates proteins that remove calcium from blood vessels and direct it to the bones. Vitamin K2 is found in fermented foods such as natto, sauerkraut, certain cheeses, and in egg yolks from free-range chickens. At the same time as K2, take vitamin D3 in a dose of 2 to 4,000 international units per day, as these vitamins work synergistically. After 3 months of such intake, the process of vascular calcification will stop and the regression of existing deposits will begin. Fifth, lower your homocysteine levels with B vitamins. Take a complex containing active forms of these vitamins: pyridoxal 5-phosphate instead of regular B6, methylfolate instead of folic acid, and methylcobalamin instead of cyanocobalamin. Dosages should be substantial: B6 around 50 milligrams, folate 400 to 800 micrograms, B12 1,000 micrograms. These vitamins cost very little at any pharmacy, but can reduce the risk of heart attack and stroke by 30 to 40%. Sixth, manage stress and inflammation. Practice deep breathing for 10 minutes every morning and evening. Slowly inhale through your nose for 4 counts. Hold your breath for 4 counts and slowly exhale through your mouth for 8 counts. This activates the parasympathetic nervous system, reduces cortisol, and decreases inflammation. Ensure you get a full night's sleep of 7 to 8 hours each night, as chronic sleep deprivation raises inflammatory markers more than smoking. Seventh, add moderate physical activity. Walking briskly for 30 to 40 minutes a day, 5 times a week, is sufficient. This will improve insulin sensitivity, increase HDL levels, lower triglycerides, and reduce the size of LDL particles, making them safer. There is no need for exhausting workouts. Regular moderate exercise that your body perceives as enjoyable movement rather than stress is enough. Now for some important warnings. If you are already taking statins, do not stop them abruptly without consulting a doctor. Abrupt discontinuation can cause withdrawal syndrome and temporary worsening of the condition. Discuss with a knowledgeable cardiologist a gradual dose reduction under the supervision of tests. If your doctor is categorically against discontinuing statins, find a specialist who understands the current data on cholesterol and is willing to work with you rather than just following outdated protocols. If you have familial hypercholesterolemia, a rare genetic disorder where cholesterol levels reach 10 to 15 millimoles or higher, this information does not negate the need for medication. However, even in this case, the focus should be on reducing inflammation and oxidation, not just on lowering cholesterol numbers. If you have diabetes and are taking insulin, dietary changes require careful monitoring of glucose levels and adjustments to insulin doses, as reducing carbohydrates will sharply decrease the need for insulin. Remember that the described approach takes time. You will feel the first improvements in 2 to 3 weeks. Energy will increase, mood will improve, brain fog and morning stiffness will disappear. In a month to a month and a half, you will notice a decrease in blood pressure if it was elevated, and an improvement in sleep quality. In 3 months, tests will show an improvement in the ratio of triglycerides to HDL, a decrease in inflammatory markers, and an increase in the size of LDL particles. A complete metabolic overhaul takes 6 to 12 months, but every day you will feel better and more energetic. I want to tell you about one of my patients, who is now 72 years old. 10 years ago, she was prescribed statins due to a cholesterol level of 6 and 8. She took them for 8 years. Her cholesterol dropped to 4, but she developed constant muscle pain, memory lapses, and complete apathy. 2 years ago, she came to me and asked, "Is this how it will be for the rest of my life?" I conducted a complete examination, saw low HDL, high triglycerides, elevated homocysteine, and C-reactive protein. The real problem was not cholesterol, but inflammation and metabolic syndrome. We gradually discontinued statins, switched her to a low-carb diet high in healthy fats, added magnesium, B vitamins, and K2. 3 months later, she returned as a completely different person. The pain disappeared, memory was restored, and energy returned. Tests showed normalization of all indicators except total cholesterol, which remained at 6.5. But now it was the right cholesterol, made up of large, safe particles. Now, 2 years later, she feels better than 20 years ago, travels, gardens, and enjoys life. If you found this information valuable and understood that cholesterol is not your enemy, please hit the like button below this video so more people can learn this important truth. Leave a comment and tell me if you take statins and how they affect your well-being. I read every comment and often respond with personal recommendations. Subscribe to the channel and activate the notification bell so you don't miss the next video, where I will talk about a product that is sold in every store but quietly destroys your pancreas and leads to type 2 diabetes faster than sugar. Share this video with friends and relatives who have been forced to take statins. This information might save someone's life. See you in the next episode. Stay healthy.